Welcome to the Deep Dive. Today we're doing a really rapid shortcut into a super important topic, local diabetes testing. Our mission for you is to pull out the biggest benefits and maybe some of the convenience factors you haven't thought of right from our source material.
Exactly. And we're zeroing in on a guide from Blood Test UK called Diabetes Blood Test in Holmfirth, your local guide. And while the name is specific, the ideas here, they really apply everywhere. So at its core, what is a diabetes blood test? It just checks your blood sugar levels, your glucose.
Simple enough?
It is, but it's so critical. Finding something like pre-diabetes early on is, well, it's your best shot at preventing a much bigger problem later.
Okay, so let's jump right into that convenience piece because the guide from Blood Test UK really flags that as a huge deal. Having a local facility, whether you're in Holmfirth or anywhere else, it just means you don't have to deal with city traffic or, find impossible hospital parking for a quick test.
Right, and that's more than just saving time. The guide really emphasizes that this convenience, it lowers the emotional stress of the whole thing.
The emotional stress.
Yeah, I mean, local clinics often have this more supportive, kind of friendly vibe. You know the people there. That community feel helps take the anxiety out of it, so you're more likely to actually go.
That makes a lot of sense.
Yeah.
So moving from the friendly local clinic to the pretty serious health risks. Why is this test so non-negotiable?
Yeah.
Beyond just being easier to get to.
This is where prevention really, really pays off. Regular testing can literally stop these huge life-altering problems before they even start. We're talking about things like heart disease,
Wow.
nerve damage, or even kidney damage. If you catch it early, you can intervene right away. And that means better outcomes, a much better quality of life.
So when we get tested, what are they actually looking for? The source mentioned something called HbA1.
Yes. The HbA1c. That is the most important piece of information you can get. Think of it like your 90-day honesty test. It doesn't just show your blood sugar right now. It shows your average over the last 2 to 3 months.
So it's the big picture.
It's the big picture, exactly. They also do quick checks, like a fingerstick blood test. And in terms of how often, if you're at risk, the advice is maybe every 3 years, starting around age 45. If you already have diabetes, you'll need one much more often, probably every 3 to 6 months.
Okay, so here's where it gets really practical for people listening. How do those results, that HbA1c number, connect to our daily life?
They're like a personalized report card. Your results show you exactly how your food and your exercise are affecting your body's ability to handle sugar.
It's a feedback loop.
A perfect feedback loop. The goal is improving what's called insulin sensitivity. Basically, eating whole foods and being active, taking a walk in one of Holmfirth's parks or your own local park, helps your body use sugar properly. It gets it out of your blood into your cells where it belongs.
That's a great way to put it. So if you're planning on scheduling a test after hearing this, what's the one key prep rule that Blood Test UK points out?
It's simple. You often need to fast. That means no food or drink except water, usually for about 8 hours before the test.
And why is that so important?
Because it gives the doctors a true baseline. They see what your blood sugar is doing on its own without any interference from, the toast you had for breakfast.
So wrapping this all up for you listening, the main takeaway is that local testing is your best defense. It makes everything easier. And guides like the one from Blood Test UK just reinforce how that convenience is key to protecting your long-term health.
And let's leave you with one final thought to mull over. If we know that regular testing improves your quality of life and reduces all that worry about chronic illness, what one small change could you make in your routine right now to get that next checkup on the calendar?